Welcome to Sisters Before Blisters, Chafing the Dream. Hi, I'm Cheryl.
I'm Christine.
And I'm Colleen.
We're three sisters living in three different countries who thought it would be a brilliant idea to sign up for a 70.3 Ironman Triathlon as a relay team.
That's 1.2 miles of swimming, 56 miles of biking, and a half marathon, combined as a team, which sounds totally doable until you remember none of us are spring chickens anymore.
We're documenting every painful, hilarious, inspiring moment of our 13-month journey from what have we done to race day glory, or a complete disaster.
Expect training mishaps, sister drama, expert advice, and proof that the best terrible decisions are made with family. Let's do this. All right, so welcome back to Sisters Before Blisters. If you are new here, we are three sisters and we're training for Ironman, a half Ironman together, but separately because we are all in different countries and we're all doing different parts of the race. So I'm the sister who is doing the bike.
And I am Christine and I just keep swimming.
And I'm Colleen and I'm doing running.
Excellent, excellent. And in this episode, we are talking about pelvic floor. And this specifically has come up because of our training and a couple of hurdles that us three sisters have encountered with our pelvic floor and having children and not having all the answers to be able to train around it, to be able to move through it, to be able to still be athletic. So we have brought on an expert, and today our guest is Dr. Victoria Marie Nunes. Dr. Vicky is a doctor of physical therapy from El Paso, Texas. She is certified in pelvic floor rehab and dry needling. She has been practicing since 2017, mainly in the outpatient setting, but has also worked in the acute care and home healthcare settings. She's a huge advocate for women's health and enjoys spreading pelvic floor awareness. And she actually played Division I volleyball at the University of Texas, El Paso. And that paved the road to pursuing physical therapy. She is married to her husband, Nico, and has two children, Roma and Micah, and they have moved to Germany about a year ago. So welcome to our podcast. Thanks for being with the sisters.
Thank you so much for having me.
Yes, yes, yes. So I wanted to ask a little bit more about your transition into Germany and maybe a couple of things that you've noticed that are a little bit different in the United States versus Germany.
Yeah, so like in the introduction, I say we just moved here because it feels like yesterday, but it's been almost a year. I've been getting like Facebook memories of when we packed our entire house, and I'm sure Colleen, you know exactly what I'm talking about. It's so surreal.
Yes.
So it's just crazy, the transition, as far as like we were living in the lodge in the hotel for like 2 months until we found a house. I was pregnant at the time, and then we had our 2-year-old and then 2 dogs in the hotel, so it was kind of brutal. We eventually found our home and we moved in, which has been great. I think now it's been settled down as far as, you know, the time change, financial type of changes, the responsibility of my husband going back into like the clinic, and then of course me starting my business, which has been awesome. But the culture is different. I grew up in a very Hispanic household. El Paso, Texas is right at the border of Mexico and New Mexico. We're very, we do a lot of fluff talk. We're very open. We smile a lot. We're like, hey, how's it going? And we just can keep going for hours. But here it's very different. You just got to get straight to the point, and then that's it, you know? And so I'm still getting used to it. I don't take it as personal anymore. I used to, but now it's just like, that's just how it is in Germany. And so, but it's okay. I think it's been a good change for the families, just traveling and getting to visit different places, meeting other people. And it's beautiful in Europe. But the other thing too is my husband and I, we love the cold. And I think we really chose the area where it's really freezing cold compared to Texas. Yeah. But yeah, it's been good. It's been good overall.
Good. Excellent. Colleen, do you have any similarities along those lines? The difference between the United States and Germany?
I'll just say that usually no one gets through or leaves Germany unscathed as far as like a move or a PCS. That's always something. It seems it's the first time the military has ever moved anyone every time. And it's a little jarring at first, but once you get to know them, they are very welcoming. And I mean, they are just very courage. And they don't do the warm fuzzies very much, but they show up in other ways. So it'll come, I promise. And not feeling settled is a very normal feeling as well. I feel like it takes like 5-6 months to start to feel normal. And then you're like, oh no, I've been here a long time. You just don't realize it until it's a little bit more settled.
Excellent, excellent. Okay, so we're going to jump into Dr. Vicky's expertise here in just a few minutes. But before we do, we're going to go around the sisters and we're going to talk about maybe something that you wish somebody hadn't seen in the last week or month. Christine, you want to kick us off?
Sure. I was able to jump into a practice with some much younger people. And
Swim practice?
Swim practice, yep. I kept up with them. I mean, these are people that are more than half my age. Some of them are students that I have in class. So I was able to keep up with them, which was great. However, I got a cramp in my shin.
How do you get a cramp in your shin?
I don't know. It was the weirdest thing. I mean, my feet were cramping too, but that's normal for me. And then it creeped up into my shin. It was so bizarre. I don't know. So I was trying to laugh it off so people didn't look at me strangely.
But you didn't drown. That was good.
I didn't drown. No, I survived.
Oh, that's not fun.
No, that was mine.
Okay. All right.
Colleen, what about you?
Mine was, I mean, I wish other people hadn't seen it, but we were at a game, so everyone saw it.
A soccer game, right?
Yeah, soccer games. Yeah. Just coming back, starting to play with the first team again. So I had a game with the first team instead of second team. And so, I kind of had to prove myself a bit more. And the field was really, really muddy. And just one of those things where like I was standing, I received just a really simple, easy path with no pressure. And I went to just turn and I just ate it and just fell. And I had kind of like creatively played the ball on the ground out of bounds because I was playing defense. And if I missed the ball, it would have been really bad. So just a little, like you're trying to play at a higher level. And I'm already the oldest in the team. And so it's like, all right, you gotta, show that you should be there. And that happened. So,
oops.
Oh, well.
It happens. Well, something that I wish that nobody had seen, not too many people saw it. I saw it. I mean, I feel bad about it. I was driving out to go get some pigeon food out in the county. And I've already mentioned that the drivers here in Windsor, they suck. And they're just jerks. And they don't know the rules of the road. Anyways, I was out to the county and I went to go get some feed. And on the way home, there's this, it's a really awkward intersection where you merge onto a place where people are turning left and you're merging where they're turning left. It's a very awkward intersection. However, I have a yield sign where I was coming from. And people were turning left. Lots of people were turning left. And I had some asshole behind me, and he was going absolutely berserk, laying on the horn, trying to push my bumper. Like, I'm like, dude, I have a yield sign, and there are people here. And he just went off and off and off. The old dude, like a white, I would put him like early 70s, wife, I think, in the passenger seat, just going after me. And it's not really out of my character, and I think sometimes is my CTE, like, really kicking in, because as he passed me, I gave him the finger, and I don't usually do that. And then I felt awful about that the whole day. And I still feel awful because I'm telling on myself right now. So, yeah. Just, yeah. Okay. So moving on to to some wins, maybe some setbacks. Christine, have you had any wins this month? Anything you want to share with us?
Sure. Earlier this month, I was able to get in early morning practice, and I was able to swim a whole mile and only took 1 30-second break. And I did flip turns at every wall, and I was very proud of myself. So,
Oh, that feels like it's a progression, yes?
yes, very much progression.
Hey,
Good
excellent.
job.
That's awesome.
Yeah. Colleen?
Oh, sorry. Let's see. Well, I'm successfully weaning the baby. So I'm having fewer symptoms that I was having, like hormone stuff. And so I'll be in a better place to start running. And I also started pelvic floor therapy more regularly and actually committed to it. So it's getting better, I think. So
Okay.
I think both of things together have helped, and I'll start doing like regular exercise, not just soccer when starting this week.
Excellent. Excellent. Mine's a win and a loss at the same time. It's gotten cold out, and my joints do not like the cold. I am not like Dr. Vicky. I do not like the cold. I like the warm. I like the warm a lot. My joints are not happy, so I ended up. I've been riding my bike in the garage, and I thought I could just like tough it out and be okay in the garage, but it is just too cold. So I've moved my bike downstairs, and I've gotten quite a few rides in downstairs where it's a little bit warmer. My joints feel a lot happier. So. Yeah.
Nice.
So like a loss kind of and a win at the same time.
When is your race? I don't know when your race is.
So it's September 20th, 2026.
Okay. Okay.
So we have all winter, all summer, and it's the end of summer, and it's up in Michigan. It's the northern part it's on the west side of the state, so opposite of Christine, in Michigan. Christine will be swimming in Lake Michigan.
Wow.
And the bike is rolling hills from my understanding, and so is the run. So it's supposed to be it's ranked very, very high on participant like favoritism. It's the number one in the United States from my understanding, and fourth in the world as far as people want to participate in this particular race because of the beauty and the course and how it's run. So it's a great race.
That's awesome.
Yeah. Cool. Okay, so let's get into some of the meat of this one. So, Dr. Vicky, we have some questions about pelvic floor, and I'm actually going to let Colleen dive right into some of the questions first, and we'll jump in as we see fit.
Okay.
First, basic question: what is a pelvic floor, and what does it do in our body?
So, our pelvic floor is a group of muscles that sit inside the pelvis. And they have 5 functions that they do for our body. So we have sphincteric, so our bowel and bladder function. Stability and support go hand in hand with like your trunk and your spine, your posture. The 4th one is sexual. So we want to have relaxation during penetration. And then we have sump pump, which is going to be your lymphatic drainage system. So it helps like drain out the excess fluid that we have inside our pelvic floor. But essentially, when somebody has issues, a dysfunction, that just means that they have an impaired coordination of those muscles. So let's say when you're supposed to poop, those muscles are supposed to relax, but somebody that has dysfunction, it tightens. So it does the opposite of what it's supposed to do. Yeah.
Okay. Interesting.
Yeah.
What size pelvic floor? Like inside the body? Like where does it run from?
So it's essentially our pelvic floor starts with our diaphragm, our lungs, goes all the way down into the deep pelvic floor muscles, essentially those muscles that are attached to the anus, to the coccyx, inside of the pelvic rim. That's essentially how like the length goes. So any type of like pressure gradient system when we breathe, or like when we do Valsalva maneuver, things like that, that's where we need to make sure that we're having the proper mechanism, so that way it doesn't lead into other symptoms as far as leakage or any type of like gas or feces that can essentially come out, right? When there's like a impaired coordination into the pelvic floor.
Yeah. I was telling my sisters, like, just after giving birth at 3 months, I was like, oh, I'll be able to run. I had a C-section with my son. This was a vaginal, so it was very different. I went for a run. I was like, why does it feel like organs are going to fall out?
Yeah.
Is that a possibility? Because that's what it felt like.
Yeah, no, for sure. I think it's like also um, you all have a athletic background, right? And I think we get so eager to return to that as soon as we feel somewhat normal when we're postpartum. But granted, like you said, you had a C-section. So I think a lot of that too, the misconception is like I've had patients where they're like, oh, I had a C-section, so I'm fine. I'm fine down there. And I'm like, no, 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 no. Like they still retract all that fascia, all the abdominal musculature to get that baby out safely. And so we want to make sure that those muscles are be able to heal properly and return back to normal, because if they don't, we have that separation of the abdominals called diastasis recti. And so that can cause a lot of instability, which can lead like your intestines are about to fall out, right? We don't want that feeling. So then when you start doing like higher impact activities, running is considered high impact, right? And so if we don't have that proper support, then it just feels really wonky. It feels really unstable.
Gotcha. That makes sense.
Question about, you mentioned, Colleen asked about where it is in the body.
Yeah.
And we talk about it from, you mentioned the diaphragm all the way down to the bottom of the pelvic floor. Does that, when we talk about pelvic floor stability or a healthy pelvic floor, does that include the organs? Does that include the intestinal wall? Like we talk about leaky gut and we talk about nutrients leaking into other parts of the body. Is that included in pelvic floor health, or is that something separate?
100%. So like you have, if somebody's having some like GI issues, especially let's say postpartum because of hormonal deficiencies, or like we're trying to get some homeostasis levels at the hormones, you can have changes in the GI gut. You can also have, as far as like organs falling out, you can also have prolapses, right? So you can have your bladder falling out, you can have your intestines literally falling out of the vagina. So 100% those organs are a part of the pelvic floor. It's a little scary. A little scary.
All three of our faces were like,
I know. I know. And it's so crazy because like I think nowadays it's becoming more of a hot topic, because I think women are like, hey, I can't live like this. There's no way, right? And so I think back in the day, women were just like, like this is just the way it is, right? I birthed children, and this is just like the consequence of me being a mother. And it's just now it's transitioning to like more, no, like it's about me and how my health and how I feel, which is a great transition at this point, right, of our timeline that we're living in. So
yeah, that's something that like I've worked as a personal trainer and coach for like 16 years. I always had, and I've had like older women who've children as clients, and they were like, yeah, I just peed my pants, and well, I can't jump because I'll pee my pants. And so with having kids, I was like, okay, so I'm just gonna pee myself from now on. Like I just like they just kind of accept it, and now I'm like learning like no, that's not quite it. So I know that's like one of the main symptoms, but what are the other symptoms of maybe pelvic deficiency?
So you can have, so one of the ones that people don't, I think it's more of like a taboo, is pain with sex, right? So like you have a bunch of like hormonal changes that we women go through irregardless if you've birthed children or if you haven't, right? And so I think one of that is the issues that I typically see as far as like, oh, you can have pain with sex. I thought that stuff was functioning all the time, right? And then of course you have the regular urine leakage. You could have fecal leakage. You can have vaginal dryness if you're going through perimenopause or menopause. The other thing too is like if somebody's having a prolapse, and let's say it's progressed to the point where they need surgery. Surgery is the last option. And let's say they have to have surgery. They have a hysterectomy. And so a lot of those patients are like, oh, I'm done. I'm okay.
Can you describe what a prolapse is before we go further?
Oh, yes, of course. A prolapse is a descent of an organ from its original position. So essentially your bladder could fall out of the vagina, your urethra can fall out, your rectum can fall out. And in this case, with a hysterectomy, let's say a patient had surgery a few months ago, what's holding the top of the vagina after hysterectomy? Because essentially your uterus is gone, right? So now they anchor the top of the vagina to a ligament in the spine. So what happens is if over time, if we don't engage properly, if we don't strengthen properly, the top of the vagina can fall out of the vagina.
Lovely.
Okay. So that's known as a vaginal vault prolapse, which is crazy, right? So like you have patients where they're, but I had surgery. It should be fixed. I'm like, it doesn't matter. Even if you had a hysterectomy, you're still prone to scar tissue. You're still prone to like different, muscular changes and dysfunctions and impairments. And so that's a prolapse where essentially an organ is falling out or descending out of its original position.
Thank you.
Yes.
Wow.
Yes. It's crazy. I
You
know.
okay, Colleen?
Yeah, I'm just like, okay.
Christine's face is also like, wow.
Yeah,
Well,
it's a lot.
it's a
scary.
lot. I have a friend who's going to have a hysterectomy in a few weeks, and so like I she had some other issues going on, and that's the reason for the hysterectomy. But like I will definitely be sharing some information with her.
Yes, yes. And I think a lot of it too is like, there's some really great physicians out there that are aware of the pelvic floor therapy, but a lot of us just have to advocate for ourselves, unfortunately, right? And so it's like, hey, I know there's a pelvic floor physical therapist that I can see. Can you please send them to me? Like, just to have just the groundwork and the foundation of just to kind of lead yourself, and you're able to do these exercises on your own and maintain. But I think it's just getting the word out there that we do exist, and this is not, the symptoms you're experiencing is not permanent, and so it's definitely treatable.
How would you know, like, the severity, I guess? Like, would you just go to a PT, pelvic floor therapist, and then get checked? Or like, how would you know if like, nope, like this is so severe, you need surgery, or like, nope, this can mix with PT?
So as far as like a prolapse or just in general?
Just like your symptoms, like I'm having these symptoms, I don't really know what to do with them. Like, go to a PT and they will either they ask me at that point and decide which route to go.
So it also depends on direct access. So it depends on the state that you live in. Let's say that you live in Texas, now is direct access. So you could look up a pelvic floor registered physical therapist in the state or in the city that you reside in. And so I got my certification through Herman and Wallace, and they have a specific website that you can look up a practitioner, a pelvic floor therapist in the city, in the zip code that you reside in, or anywhere in the world. And that's how you can start off. And they'll give you the clinic name, they'll give you the contact information, give them a call and be like, what's the process? Do I need a referral? Do I need to go see a PCP first, or I can go see you directly? So with us pelvic floor therapists, we prefer that you see a gynecologist or urologist prior to coming and seeing us, because let's say come and see me and you haven't had a pap smear or a vaginal exam in 5 years, it's probably best that you go see a physician or a gynecologist, urologist first, just to make sure that there's no other medical issues that might be occurring, if that makes sense.
Yeah. Gotcha.
What would a evaluation look like? So let's say that you've gone to the gynecologist, you've had the regular annual or semi-annual tests taken care of, you're in a good place, but you're still having issues. What would an evaluation look like if I were to come to you?
So we would basically do first past medical history, just talk about what's going on, how long you have the symptoms, is there any pain involvement, how's your bladder, do you potty throughout the day? So we talk about all that good stuff first. And then once I kind of get a feeling of what could be the potential issue, then from there we do observational tasks. So like I'll look at your flexibility of your spine, your squatting mechanics, how you're walking, how your flexibility is. I take you to different positions, standing, sideline, supine, prone, just to make sure like if there's any type of dysfunction happening at your pelvis, on your core, on your lower extremities. I check to make sure that you do not have a discus recti. So a discus recti is any abdominal separation that you may have postpartum or even just after surgery, any abdominal surgery. After we do all the external work, if you allow me to, I will do the internal exam with consent, of course. And so from there, I'm palpating the external tissue. So the labia, I'm looking at your perineum, which is basically the middle point from the separation from the vagina to the anus. And I'm just talking you through these things. Is there any pain or or I'm sorry, pain or tenderness with palpation on those external structures, then I visually see what's going on. Are you able to Kegel? Are you able to activate the pelvic floor? Are you able to bear down? Bear down is also very important in terms of having a bowel movement and having those muscles to relax. From there, then I do the internal exam with one examining finger. I get to palpate, get to stretch out the tissues. You get to let me know if there's any pain or tenderness, if there's any trigger points that I may feel. Once I go into the deep pelvic floor, then I'm able to actually test your strength of your pelvic floor with a Kegel. So we'll do like a fast contraction. After that, you get to hold it. I get to feel how long you can hold it. Once I feel like that muscle let go, then we stop. And then from there, we do repetitions of how long you held. Let's say you held for 5 seconds. Okay, we're going to do repetitions of 5 seconds until you fatigue. Now, the last part is fast repetitions. I get to count to see how many you can do before you fatigue. Now, at the very end, then I get to test your prolapse. So I get to see if there's any descent that's happening on the anterior part of the pelvic floor, which means your bladder, your vagina, your urethra. And then I get to test posterior, which would be the rectum, to see if there's any prolapse. And then from there, you're good to go. Then we discuss like what I found, what we need to work on, what you can take away for homework. And then of course, from there, we just like, let's schedule the follow-up. And that's essentially what I try to fit in the entire hour. Sometimes it's, I need more time. But that's essentially what like evaluation would be.
I feel like that's so in depth compared to what most women just get, like, here's the sheet of 5 exercises that you do every day and you'll be fine.
Yep.
Like that's what happens. Or they're small. Christine, did you kind of,
yeah, no, that was my one of my questions. Is like, well, like the doctor says, well, are you doing your Kegels? Like, is Kegels enough? Is that it? So
that is like, oh my gosh, so annoying. it's so annoying. And granted, I try to also understand, like, I know physicians have so many patients. I totally get that. But it shouldn't be an excuse to give that quality of care to a patient that like, hey, if they're having pain with sex, they probably don't need Kegels. Why are we issuing out Kegels if they have pain with sex, right? We should be able to like, you know what, let's refer you to a pelvic floor physical therapist so they can do an in-depth assessment to ensure that this is what you need, right? As far as treatment intervention, or like maybe you need bladder training techniques, and maybe we need to work on deep breathing, and maybe we need to switch up your core activities while you're squatting. There's just so many other things that we can target as opposed to here, your Kegels, just work on them. And it drives me nuts. It like drives me crazy. Patience.
Oh my gosh. Yeah. No, and I know we're just talking about like mostly women and mostly like after birth, but is this something that men deal with? Is this something that women who haven't had babies deal with? Like,
yes, 100%. So like the youngest patient I ever have treated was 15 years old. Obviously her mother was in the room because she was underage. And so there was no sex dysfunction, no like menstruation connection. There was no sexual trauma, but she was born with Ehlers-Danlos syndrome. I'm not sure if you're aware from that. So essentially, somebody can be born with very excessive mobility in their ligaments, their joints, very hyper flexible to the point that it can be dangerous. And so she was wetting her bed 3 times a night, every single night. Okay. So, and she had this like weird reflex too with her kidneys and her bladder, which of course that was being treated by the urologist. But she referred her to me to get some pelvic floor strengthening. And she was just, for, more of like the slang term, she was loosey-goosey. I mean, she just, poor thing, didn't have any core, didn't have any control. And so there's that case. And then of course I've had my males. I am trained in the male population. It's not my favorite. I love my females. So, but with my males that I have worked with, it's a lot of prostatectomies if they had cancer. I did have the occasional where it was a lot of nerve related impingement from the spine that was causing some like erectile dysfunction, or they had like leakage with like stress related activities, just like us women would do if we were to jump and cough and sneeze, they would essentially have the same thing too. So those are kind of like the broader, you know, spectrum of like the younger population and of course with the males.
Mhm.
Gotcha. Wow.
Yeah.
I mean, it's amazing that it's like such a, it's like a secret, right? Like, why is this not public? Like a huge deal everywhere.
I know.
It's insane.
Totally get that. I totally get. I'm trying my best to like go and talk about this as much as I can, because if I can try to just spread a little bit of that awareness, I mean, that's what we need. We need to help embrace the change, but also just help each other be aware of like these changes, but also know that there's people out there that can assist, you know?
Yeah. Is there anything that's like preventative work? Maybe for, I know Christine, like your girls are starting, well, your oldest is starting into her teenage years, and like, is there something preventive maybe?
Yeah, for sure. Like I think a lot of it too is just being able to breathe properly and how to brace properly. But then also I've noticed too, like with my teenagers, when they go into like the high school sports, it's the when they start going into weight training and there's somebody that's not physically there showing them the proper technique and how they're like, oh, let's lift heavy, let's lift heavy, let's lift heavy. And that's not the important thing, right? So if we are trying to get these girls to get stronger, which is fine, we need to make sure that they're bracing properly and they're not doing a Valsalva and they're using diaphragmatic breathing to ensure that they're engaging the core and the pelvic floor during the lift, if that makes sense. So yeah. I think for sure, when it starts at that young age, we can definitely try to do those preventative measures, because then let's say they're succeeding into the Division I level, which those people should be more qualified, right? You have some certified strength and conditioning coaches, which is fantastic. And I myself, I had a wonderful experience, but I know that I've had athletes where they just didn't have that person where they were like, hey, like you needed to change your technique. Like, hey, you were probably holding your breath. You looked like you were going to pass out. You know, and that's where it gets a little scary, because those athletes are high Division I athletes and they're still leaking. So that's a problem, right? And so I think it just comes with like the knowledge of us young mamas trying to tell these ladies, these young ladies and young athletes that we're working with, this is how we build the foundation work, the framework, to that way we can prevent any of those pelvic floor dysfunction issues that may arise in the future. And then just prepare also for motherhood if they choose that route, right? And like how our body changes with pregnancy, and then we have the postpartum journey. So it's a lot, right? And so it gets a little overwhelming.
Yes. If it's not addressed, if pelvic floor issues are not addressed, will it lead to, I mean, we talked about the prolapses and everything, will it lead to something more severe?
There, in the most severity case that I've ever heard of, and this was when I was taking my certification courses, was one lady that had her third baby and nobody told her about pelvic floor therapy, and she ended up having a massive diastasis recti, where the organs and the intestine were actually pushing out from her abs, and she needed immediate surgery. And I don't know how it got that far to begin with, but that was the most severe case I've ever heard. Of course, compared to the prolapse. The prolapse is kind of also scary. I had a patient that was a stage 3. So what that means, so stage 4 is a complete aversion. That is completely out. So that lady that had the diastasis recti, that was essentially a stage 4 in that sense, where she needed immediate surgery. But from the vaginal aspect, I've had a stage 3 where it's practically 75% out of the vagina and they needed surgery at that point. But I think that's probably the most severe as far as trauma wise, right? Where you need that surgery as like the ultimate option.
And I mean, you mentioned perimenopause and everything. Does it get worse just with age and as you go through menopause, or can you fix it at any stage? Is there like a stage where it's like your muscles are just not strong enough and you can't go back? Like, I mean, older women and stuff. I don't know.
So for sure, like we're fighting against time, unfortunately, right? And especially with us females, we're going through so many transitions and cycles. And so when we get into the perimenopausal stage, that's when we start experiencing vulva changes. So your vulva is part of the vagina, and so you get dryness. There's like itchiness that you can also get. There's the migraines, there's that hormonal fluctuation. Well, what happens is the dryness is the secondary characteristic to the vaginal lining thinning. So your labia starts to thin, the pelvic floor starts to thin because we're getting a drop of estrogen. And a way to, I wouldn't say to prevent that, but just to fight through that change is, of course, getting topical estrogen to try to get that stuff lubricated, but also getting that bulkiness back into the muscles. And the other thing too is that resistance training is the number one thing that us females we need to do, and we need to continue. We cannot stop. Running is important, cardio is important, hiking is important. That's all fantastic, but we need to resistance train and to reduce the osteoporosis, because we're going to get that with the menopause. That's the other side effect. And so if we're continuing to maintain that muscle bulk, getting those weight training sessions in, then we can prevent that from just being worse than what it's supposed to during that cycle period, right? And it's a point where I wouldn't say it's permanent, but if we don't make those changes early enough, then it's just going to make it 10 times harder, right?
So the resistance training, the weight training, those would be things, I'm thinking for my children and myself, and those would be things to kind of prevent this in the future. Okay.
Yes.
Thank you.
And that's where during that perimenopausal, menopausal stages, since there's a drop of estrogen, you are more likely, if we don't have that proper strengthening in that pelvic floor and core, that a prolapse will occur. So I actually have a patient right now who, oh my gosh, poor thing. And here in Germany, Colleen, it's very limited as far as pelvic floor. I don't know if you've seen, like, as far as the physicians, the gynecologists, it's very different here. And so my patient, poor thing, like, she's struggling really bad because she's getting changes really quickly, and she's very young. She's 45, but the doctors are like, oh no, perimenopause doesn't start till 50. I'm like, no. It can start in the 40s. It can start in the early 40s. And so it's unfortunate because they're kind of pushing it aside, like, oh, you're fine. Don't worry about it. You're fine. But she's having prolapse related issues, dryness, all that stuff. So it gets a little scary.
Yeah. Some things are like really good with, like when you're pregnant, I feel like they're very good here, but then like afterwards they focus on the baby, they make sure the baby's good, but like the mother's like, okay, bye.
Yeah. And
you're fine.
Did you deliver in Germany too?
Mm-hmm.
Okay. So it was funny because I delivered my son here too. And it was like the second day, and they come in, this lady comes in and she's like, oh, here's a sheet. This is how you do your Kegels. I was like, oh, I'm a pelvic floor physical therapist. And she was like, oh, then you know what to do. But it was a basic sheet of like, there was no breathing, there was no bracing. Like, it was just like, oh, make sure you activate your key. I'm like, I just delivered my kid 2 days ago. I'm not going to activate it right now. Like, there's no way. I need to heal, rest. It's just like, it's different. It's just different.
Yeah, and I didn't get any of that actually at all.
Oh my gosh.
I got nothing. Like, I was just me and the baby hanging out in the room.
Even here in the States, like, I didn't get anything for me. There was nothing. Like, I got, checked out the 6 weeks after, and that was it.
That was it.
Yeah. And that 6 weeks checkup too is very like, oh, are you okay? Do you have pain? Like, you can have sex now. Like, it's totally fine. You're fine. Like, it's.
So part of my frustration being in the healthcare sector is that we find that many of our gynecologists, many of our female specialists are male. And I don't think that they really understand the sensations that happen in the female body. And I don't think that although they can have a cadaver, they can do surgery, they can actually see the structures, but what those structures feel like inside and how they interact with our soul, our brain, the rest of our body,
Yep.
I don't, I have a huge frustration of why can't we have more female specialists that actually understand the sensations?
Right. And I usually tell my patients, like, so I was fortunate in El Paso, a very personal friend of mine through the volleyball world. She was my OB, and she is a huge advocate for pelvic floor therapy. And so I'm like, oh, thank God. Like, it's like I tell patients, when you find that doctor that really listens and advocates for your health and your well-being, please don't let them go, because then they're aware of those changes. Of course, she's female, so she understood of like everything that I was experiencing and all her patients, and like whenever they needed that external, whether it was pelvic floor therapy or a GI specialist or a hormone specialist, they were able to make that referral for what that patient needed. But you're absolutely right. Like, I think it's when you're a female and you can understand. Now that I'm a mom, I'm like, oh, I totally get it. I totally get what you're experiencing. You are not crazy. Let me help you. But when you don't have that relation, it just makes it much more difficult, for sure.
Mm-hmm.
I guess I have some questions on like bladder spasming and bladder leakage and like overactive bladder. Like, what are there specific exercises for those types of things?
Yeah. So in those cases, there's we got to figure out why it's spasming. It could be so many factors. But what we want to do is train the bladder, because once it gets into this funk of like, oh, it's been 30 minutes or it's been an hour, you got to go pee. It starts training your brain and those nerves to like, hey, we got to go. We got to go now. So we need to shut off the brain. Shut off those nerves that are telling the brain that like, hey, we got to go. We need to calm the nervous system down. And so what we need to do is work on deep breathing to try to distract the bladder. And another way is to add Kegels, and Kegels will help contract and hold it so that way it doesn't seep out any of the urine, excuse me. And it can take some time, because we get into it's habitual, right? Sometimes we get into these habits where it's like, nope, let me go pee. It's been every hour. And then granted, we have to take into account what you're taking in as fluids. My rule of, I don't say my rule of thumb, we were trained that for water intake, it should be half of your body weight in fluid ounces. However, you three ladies are training like crazy every day. So we need to account for that depletion, right? And so if I weigh 140, I should be drinking at least 70 fluid ounces of water per day. Now, I've had patients where they train and they weigh 140 and they're drinking 128 fluid ounces of water. That's a gallon of water. That's a lot. And it depends on what type of workout you're doing, right? So we want to make sure that you're hydrated, but we have to make sure that we're trying to find this happy medium to where you're able to train, you're able to go to the potty every 2-3 hours, you're able to not leak and hold the bladder, make it to the bathroom on time, but then you're able to have hydration at the same time to purposely make it through your day, but then also make it through your workout, right? So that's a lot. I know it's a lot. But yeah, so we have to figure out why it's spasming, but we have to make sure that we get that bladder trained to where like you're able to enjoy and not going to the potty every 30 minutes, every hour. The other thing too that can cause a spasming is I don't know if you're all familiar, interstitial cystitis. Is anyone familiar with that?
Heard of it.
Okay. So interstitial cystitis is essentially like it's also referred to a painful bladder syndrome. They don't know exactly why it happens. It's just like a weird thing. It's almost like a little infection that happens in the bladder, but it gives the same symptoms as a UTI. So somebody that has numerous UTIs, if they tell me, Victoria, I had 5 or 6 UTIs this year, I'm like, it's not a UTI, it's an interstitial cystitis. And so basically what happens is there's these little brown deposits that start to I wouldn't say take over the bladder, but they just start to come up and it starts to irritate it, and it causes the bladder to, we got to go. It starts spasming to let go of whatever urine is building up, because it just can't take it, can't hold the urine. So then when you go pee, it doesn't pee that much because you only have that a little bit of fluid that's inside. You get pain with sex, you get some itchiness, you could get some dryness. And so the way that's treated is you have to go to the urologist, they insert a pain medication to flush all that stuff out, and then you still get pelvic floor therapy at the same time. And so that can spasm and cause some of that increased potty breaks that you have throughout the day. But this one is one that I really like to talk about because not a lot of people are aware of it. People are like, "Oh, I just have a UTI. I'm prone to UTIs." I'm like, "No, we're not. That's not normal." And a lot of that can lead into pain with sex, potting throughout the day, some dryness. You can obviously get some leakage because it's not able to hold that much urine. But we definitely need that to get checked with the urologist to flush out that excess stuff.
Yeah. So a lot of times we see with a lot of UTIs, we see people who have a bacterial dysbiosis. So the good bacteria is low and the bad bacteria is high, and that will cause infection and discomfort. So along those lines, I'm wondering, and this may be outside of your expertise, but when we talk about the nerve, the bladder signaling through the nerve to the brain back down to the bladder. Uh, when we talk about that nerve and the myelin on the nerve, we know that viruses can really affect those nerves and how they communicate. And I don't know if you've had any experience where, say, like a herpes virus or Epstein-Barr or some type of virus affects that spasming signal.
Interesting. I've never had a patient with that. That's actually a good question. I imagine that would definitely impact it for sure, like how we are able to with our parasympathetic system, right? To stop and store, and then to of course eliminate when we need it, but or when we're ready to. But I imagine for sure, especially with like, and I'm thinking of excuse me, of neuromuscular like Guillain-Barré, that of course is impacted too. But for sure, I would imagine with the viruses that it would definitely cause some spasming or just some delayed type of notification. Am I saying that right? Like a delayed sensation. But yeah, that's a great question.
Something to look into. Yeah.
For sure, for sure.
Yeah. While we're doing this training, and I don't think Cheryl has any pelvic floor issues that we know of, but
I mean, I'll be honest. Like, I think that there are some times that I think I won't have urine leakage, but like there's a sensation. I'm like, okay, well, clearly I need to work on my core, my pelvic floor. I'm the oldest of us three. I've had back surgery. I've had a number of injuries to my lower half, and I think that all contributes to the complexities of pelvic floor health. And so, yeah, I think that it's do I have a direct issue that is completely applicable to my sisters who've had children? Not so much, but I think I'm that good example of you don't have to have kids to still address this.
yeah.
So you're
Yeah.
gonna say something. Sorry, Colleen.
No, go ahead.
Go ahead.
No, my question was just what is something that even just the three of us could be doing then on a regular basis during our training? Like what's one thing that would help during our training just to support the pelvic floor?
Yeah, so for sure, you can work on proper diaphragmatic breathing, utilizing your rib expansion. So a lot of the times, when patients come in, we're like chest breathers. It's this, right? We move with the breastbone when we really need to relax here and utilize our tummy. And the best way that I can explain this is inhaling through the nose. Your belly should enlarge. Uh, every single time. We want that expansion. We want those ribs to flare out to get that air into the lungs. Now, when we exhale, we should be exhaling with pursed lip breathing. So it's almost like you're blowing a candle, slowly blowing out a candle. When we do that, what happens is it deflates, it comes back into its proper position. But then when we exhale slowly, we get a beautiful activation of our transverse abdominis muscle. Our transverse abdominis is the lower part of our, essentially below our belly button. That's the guy that is connected to our pelvic floor. There is research that has shown that there is a co-contraction that happens when we Kegel or when we do a TRA. It's called a brace. So a transverse abdominis brace. And so when we breathe properly, we're essentially activating our core and our pelvic floor at the exact same time, right? And so when we don't have that as our daily function, doing our regular daily activities, and of course, even more importantly, when we're doing resistance training, we're swimming, when we're running, when we're cycling, that's when it starts to get impaired because you get fatigued, right? When you're adding more stress to the body. And so when we have that foundation as part of a habit, we want that to translate over to your training. And of course, it's, I hate to be like, do your Kegels, but when you're swimming, when you're cycling, we shouldn't be up regulated the entire time. We want that proper tone. And so our pelvic floor muscles are basically type 1 muscle fibers. And so they're endurance type of fibers. So we need those guys to be turned on in a proper tone, but not essentially in a Kegel. Does that make sense? I hope that makes sense.
Yeah, understand.
So what we can do is, of course, basic Kegels that you can apply throughout the day. So let's say you're about to pick up your baby. I want you to Kegel, but you should be able to Kegel and breathe at the same time. And that's the hard part. So patients will be like, oh, I'm Kegeling, Victoria. I'm like, no, you're not. No, you have to, like, right now, I'm speaking to all of you and I'm Kegeling, right? But I'm breathing. So that's where it kind of like, we have to go back to square one. So if you ladies are able to coordinate that, that's beautiful, right? And so you can apply that through your day-to-day tasks and then really challenge yourselves during your workouts to make sure that we're having that proper breathing and bracing to ensure that that pelvic floor is being contracted when we want it to.
Cool.
I have a question about like just athletes in general. And you might have covered this, but I'm curious if I ask it in a different way, if there might be a slightly different answer.
Yeah.
So if we have athletes and they're in let's say they're D1, they're in the weight room, they're trying to do everything properly, the best that they can. Obviously, they're pushing as hard as they possibly can to be able to perform at the top.
Okay.
Do you see compensation patterns in those types of kids, athletes that you haven't mentioned already? Like, is there a thing that kids are like, when I'm thinking, okay, I'm thinking of, I'm in the weight room, I'm doing a squat. How am I compensating? How am I covering up my weaknesses and that nobody knows about, but I know? Like, how am I, like, am I sneaking it past anybody? What is that pattern?
So for sure, I think it's and I'm gonna go back to this, like, and you're right. I think I've said this is the Valsalva. You're holding your breath the entire time and you're peeing yourself without everybody looking at your underwear, right? And so, like, I've had patients who are D1 athletes and they're just like, oh, Victoria, I PR'd on my hand clean, but oh my gosh, I like peed myself. I'm like, no, that's not functional. That's not your proper strength score. I'm sorry. If I were your coach, I would have deleted that. But I think because of the lack of awareness with some of these coaches is they don't, and I hate to say this, and correct me if I'm wrong, but they don't care about that. They don't care that you just peed yourself. They care that you just lifted 225 pounds. Oh man, she's strong. She's great. She's going to excel on the court. But, and it's surprising to me because some of those athletes that from the school that I played at, they would come over and they would kind of whisper to me like, hey, Victoria, I'm a middle blocker, but like in the entire match, I probably like pee myself like 5 times. What? Like, how is this happening? Right. And I think when they're training and they're in the weight room, they don't vocalize that because there's a lot of male strength coaches. They have their athletic trainers, but I don't know. Again, I think it's a taboo thing. I think it's just a taboo thing. And it's like, it's probably temporary. It's probably temporary, but it's the 100% Valsalva maneuver to try to lift the weight as much as they can to prove that they're coaches, that they're ready and that they're strong and that they deserve to be on the court or on the field.
Mm-hmm.
Well, it's the same as, like, I mean, anyone who's trying to hit a higher number or a high squat or a high bench or a high clean or a snatch or anything like that. If there's a dysfunction in the movement itself, you're not going to count it, right? Like, nope, that wasn't clean. Like, you need to take your weights off, reduce it by 5 pounds, and then that's where your number is. It's not it's not this terrible one where you had to walk out of it or your shoulder was wobbling or you're not stable, whatever. I guess it's the same way. It's just internal, so you don't necessarily see it unless it's on the floor.
Yeah, you're exactly right. Because I think we can see that, like, if somebody, I don't know, is doing a squat and their right knee is caving in and they have a valgus move, it's like, oh, that doesn't count. Sorry, like that's
Right.
we want to prevent injury. That's it's spot on, right? And so, or if you're hunching over, rounded shoulder during a deadlift or whatever it is, it's easy to correct that, but when it comes to the internal stuff, they're like, ooh, we probably shouldn't address that because I'm a male or I don't know that much about the female anatomy or whatever it is. But
You get
Yeah.
accused of doing something inappropriate if you talk about it.
Exactly.
Yeah.
And so my husband, he works for the government, and he actually was the P3T, pregnancy and postpartum trainer director in El Paso and Fort Bliss.
Okay, yeah.
He had me go speak to the staff about pelvic floor awareness and dysfunction, and you you should have seen their faces. They were just like white, like they were like, how do we address this with pain? And I gave like little examples, like, guys, we females have a vagina, you all have penises, we all have an anus, we all have to poop and pee, like this is normal bodily functions, and this should not be something where you have to be, I hate to say, but creepy about it. You can literally take a soldier to a side and be like, hey, like, are you experiencing any, whatever the issues that she's experiencing. But I gave them examples on how to incorporate the bracing and how to incorporate the Kegels when it's linked to a pelvic floor weakness, right? But again, if they're having an upregulated pelvic floor, if they're having pain with sex, Kegels is not going to work, right? And so it gets to that point where I think they get a little scared and it's too much, and they're just like, I'm just not going to address it, and we should refer to a pelvic floor therapist, which is fine. But it was funny though, because he had me go and talk to the staff, and mainly it was men that were the strength and conditioning coaches. There was like a few female athletic trainers. There was a female physical therapist, but everyone else was male, and it's just, it's kind of funny to have that as the target audience sometimes, because they get a little weirded out, I guess.
Squeamish.
Yeah.
Yeah. You have no idea how much, maybe that amount of time, that small amount of time that you spent with them could have changed their perspective for the rest of their lives.
Yep.
And maybe, in their white ghostly face, they didn't show it, but they heard it.
I do understand the squeamishness from the male's perspective, but there's a line where it's, this is all medical.
Yep.
And if this is not comfortable, then you can go somewhere else.
And I think that's really important to encourage women, young women, underage women, to advocate for themselves, to have a party that they trust in the room with them.
Mm-hmm.
I think it's so critical to have a buddy that is going to have your back. And I hope that Christine and your kids, Colleen, you just had a daughter, so I think it's really important that our kids have that confidence to be able to say, you know what, just hold on a second, I'm on board for some medical treatment. However, I want to have my mom with me. I want to have my dad with me. I want to have my big brother with me. I want to have my sister with me. I want to have my best friend with me. Somebody that actually cares.
Mm-hmm. Or willing to be, or, have our kids be willing to be that other person for someone else and offer it and say like, hey, like, you want me to come with you? I'm happy to speak on your behalf if you feel nervous.
Well, and I think that this is, a big change that's coming with women in general. We're talking about these taboo topics. We're talking about everything. Everything is just becoming more open, and I feel that it's wonderful that, we're raising women up and not degrading them.
Yep.
Pushing them aside, where it's like, you'll be fine, you'll take it on, you'll figure it out, which I mean, yes, a lot of times we do, but
later in life that we figure it out.
Right.
Christine, Colleen, how are you doing on questions? Do you have a few more?
I think mine were all answered.
I know, mine too. You were so thorough, Doc.
I have a question, and it's not, it's Christine.
What is it, Cheryl?
It's related, but it's not related. So I was reading an article not too long ago about Christine. So it was about standing and peeing and how men stand and pee.
Yes.
But it's a North American learned behavior, and that for the pelvic floor, including men, that it is more appropriate to squat, to sit, to squat is appropriate, but we sit. Do you have any insight around that?
Yes, that is 100% true. It is true. It's so funny because my husband was born in Germany. Long story, and we met in El Paso, but I always, before I became a pelvic floor therapist, they were raised to pee sitting down, and I always gave them shit for it. I was like, oh my God, why are you doing it? Because I was raised in the Hispanic culture, in the Hispanic community. We did not train our boys and my brothers, or, like in general, like all the men stand up. And so when I became a PT, and then when I got my certification, I was like, oh my gosh, I'm so sorry. I'm so sorry that I made fun of you. And so, but yes, you're absolutely right. So essentially when we sit down, just like us women, when we sit down and we pee or poop, we have a relaxation of the pelvic floor. And it's obviously improved when we have our feet elevated, right? So let's say you have a stool, right? And you put your feet on the stool, that opens up the rectum, that relaxes the pelvic floor, and it allows things to flow better. And so, yes, so it's a very European thing for men to sit down, and they have less prostate issues over time, which is crazy to like have that correlation, right? And so, so I try to tell like now that I've been certified for a few years now, but like I try to tell my men, like, hey, go sit down, like go sit down and pee. I know it's gonna be a weird habit, but you have to do it. And so I tell my husband, yay, honey, you're doing great. You're above the spectrum now. Like you're doing awesome. You started off at a young age, so hopefully you don't have any prostate issues as you get older. But yes,
yeah,
great question.
See, we're just starting to potty train my son, and so he's comfortable sitting, but we have they have all the tools. So like I think I have every training potty in the bathroom at the moment that I could possibly find, just to try and like get this done. And one is like a standing little frog with a little target and everything like that. And so now I'm like, but he likes to sit, and I'm like, well, is he gonna be the weird kid that like sits when he beats? But you know what, no, he's gonna be the healthy kid. So that's what we're gonna do.
Yep. And I don't know, like I know like the toilet is not always gonna be there, right?
Yeah.
Totally get that. So I think for men it's just easy for them if they're out somewhere and they need a pee, they can just stand up and do it. Totally.
Yeah.
And then like I think the other thing too is like public restrooms, the hygiene type of stuff. And usually patients will be like, what do I do if I'm on a road trip or if I'm taking a 10-hour flight, right? Like, what do I do? That all that stuff is gross. I totally get that. And so I usually tell patients, you got to carry those little liners. You just have to, because then you're just putting yourself more at risk, and you're going to just put yourself more prone to getting an infection if you're going to hold your bladder for that long. I usually tell them, you got to take those liners because we got to do it. We got to empty. Yeah. I recommend the 2-3 hours, but 3 to 4 hours, that's it. Like we can't go any further, because then that just makes you just more prone to issues. And so if you don't like that stuff, the public stuff, just take those liners with you. And I know it's more of a hassle, but I mean,
I'm a squatter. Colleen actually, I think for Christmas sent me liners as a gift.
So Cheryl came to visit us in Germany when we were here the first time. We were here in Baumholder from 14 to 18. And we were traveling, and I was like, Cheryl, like, what's wrong? And she was like, no, let me show you exactly like what a toilet seat nest should be. And she took up so much toilet paper. Just like it took like 10 minutes to set up like the toilet seat for her to even like consider sitting down. And me, I'm a little bit more like, yeah, whatever. Like, I'll drink water. Like, I'm not too picky. And I was just like, you do this every time you have to pee. Like, no,
every time I have to poop, and I feel like I'm gonna be there for a minute.
It was literally.
If I'm gonna pee, I'm just gonna squat.
Well,
it was not just a cover, full nest.
No, I have to say this. It takes you 10 minutes to do that and you're able to hold your poop for that long. Oh my gosh. Like that is amazing pelvic floor. You know, hold it that long. That's awesome.
I don't like germs.
I get it. I get it. There's some nasty restrooms out there.
Yeah, don't use the ones on the side of the road in Europe. I
know. I noticed that. Yeah.
It's just like a cold steel bowl.
Yep.
There's no seat. You just.
Yep.
Well, and they're few and far between in Europe. Like you got to take advantage when you see a restroom or food during certain hours. If you get to see either of those, take advantage, even if you're not hungry or you don't have to go to the bathroom, and then move on because I feel like it's so few and far between.
Yeah, or they pay for it like euros. €1, and that's when you're like, oh, okay, maybe this is a decent bathroom when you have to pay.
Sometimes. I've been in a few that I was like, ooh, I just paid for that.
I know. Christine's gonna learn real quick. She's coming in 2 weeks. You're coming? Yeah.
It's gonna be
2.5 weeks. Yeah.
It'll be great. It'll be a great time, and you're gonna go to the bathroom.
Well, what I was thinking was, is it still like? Do they have laws against like indecent exposure if you have to go on the side of the road?
Not in Europe.
No, they don't.
No,
they don't care.
Yeah.
I've spotted by many side of a cars or bushes, or at a festival, you just find a corner and you just use your dress. You use your dirndl and you hide. You're fine.
Yep.
I don't wear dresses.
Is it your first time visiting?
They make pumpkins.
Are you flying into Munich?
I don't know, Colleen. What am I flying into?
You guys are flying. They're flying into Nuremberg because we're in Ansbach, so we're on the other side. Yeah.
Oh my gosh, you're gonna love it. It's cold, but you're gonna love it. But you're in Michigan, so you're fine.
Yeah, same.
Yeah,
same.
I'm super excited.
Good. You got it.
Yeah. Oh my gosh, you're gonna love it. The Christkindl market, it's beautiful. It's beautiful. Yeah.
Yeah. It'll be good.
It'll be great.
So, Colleen, you are 7 months postpartum, or what?
Yes. 7 months on the 29th. Yeah.
You had your baby on March 29th?
April.
Oh, okay. I had my baby. March 31st.
Oh, okay. Okay.
Yeah.
Yeah.
That's a crazy story in itself. I drove myself to the hospital when I was in labor. Yeah.
Mine was same. It was she came within 3 hours. I started like contractions at 5:30 in the morning, 2 minutes apart, and then had the baby at 8:15. Like I thought for sure it was gonna happen in the car.
Yep.
Mine almost did. My last
Christine
did.
like
insane. I got to the ER. They're like, here's the wheelchair. Do you want to sit down? I said, no, I'm gonna sit on her head. And she was born within 11 minutes.
Oh my god.
Wow. Oh my That's so fast.
I evaluated a patient 2 weeks ago. She had her baby girl like 2 years ago here in Germany, and she had her baby in the car. She came so fast. Her husband drove to the hospital, parked. He ran inside to get the nurse, and by the time the nurse came out, she had the baby in her hands. I'm like, oh my god, that's just, women are incredible. I will say this every time, like, we are amazing. We deserve gold medals every day.
I mean, you don't have a choice. Like they're coming. Like you can't do anything about it.
Yep.
But
I think we take on that same type of attitude with like our health. Like it's just something that we have to deal with. So we just keep going because we don't have another option.
Yeah. Yep. We can, and it's like we are able to juggle so many things at the same time. Like we're breastfeeding, we're picking up stuff around the house, and we're bleeding, and then we sneeze and we pee ourselves, and then we have to, it's like it's crazy. We're incredible. That's all I have to say. Yeah.
Go ladies. Go ladies.
Yes.
Christine, you have some questions for us?
I do. So this is the getting to know the sisters. And Dr. Vicky, if you would like to, well, this maybe not, but if you have something else that you'd like to share, that would be absolutely okay. So I have, who is most likely to go skydiving? You would?
You know, none of us rose our hand.
I would.
Yeah.
I want to.
I've always wanted to. But I want to choose a place like Hawaii or something of that nature, or I don't know, just the ocean, something like that.
They do it in Austria.
Really?
Halfway.
Well, here's the thing. Well, here's the other thing that I'm scared about. It might be stupid, but it's the language barrier. I want somebody that knows like really English so I can understand and like, yeah.
Yeah.
So,
Gotcha.
good question. That's me. The skydiving.
I would have to, I really have to think about it and convince myself.
I
to
mean, if
jump
somebody
out
was
of a
gonna,
perfectly good airplane.
if somebody's gonna pay me $1 million to do it, I'd consider it.
Oh, wow.
Oh, I want to do it. Ian and I talked about it a lot. I want to do it.
All right, here's the next one. Who's most likely to excel at pole dancing lessons?
Colleen.
Yeah,
Colleen.
Colleen.
Okay. First of all, I have a theater background. That's the only reason.
And she's only about 5 feet tall. So if she falls, it's going to be like a contracted, like a small ball of athleticism. Just like,
don't you worry, I won't fall. I got this.
Oh my! I would probably join you, but I probably wouldn't be good at it.
I think it would be a lot of fun.
Yeah.
Have you seen the classes where they do the with the, like they're hanging from the ceiling and they fly and they're
with the big cords of
yes.
Yes.
I can't think of the name. I'm sorry. Yeah. Those look like fun.
Those look like fun.
It's like you have to have some really solid core to do that stuff. Like that's pretty incredible.
Yes.
Mm-hmm.
Yeah.
All right. Let's see. Who is most likely to sleep through breakfast?
Yeah. Sure.
Cheryl likes to sleep.
I think so like a full picture of everything. So I didn't know this until more recently into my healthcare journey and my CTE journey. So Dr. Vicky, to catch you up, I played a lot of soccer as a kid in college, and then I played a ton of football. I played 12 years of women's pro football, with a helmet on and pads and driving each other into the ground. So very concerned about CTE, very concerned about my brain health. And I was having some massive issues with memory, with concentration, could not sleep, incredible insomnia, digestive issues, all sorts of components that are associated with CTE. And I thought, okay, this is my trek. I think maybe dementia is started, and I think that maybe I'm headed down that track. And suicide has definitely been on my mind. That's how a lot of football players or rugby players in their lives, and they'll usually shoot themselves in the chest so that their brain can be studied. So all of these things are swimming in my head, and I'm thinking, okay, I don't want that to be my trajectory. What can I do differently and be proactive about regaining my brain? And so I went down all these different avenues. I've done tons and tons of therapies. I've done a lot of like brain therapies, like eye therapies, audio triggers, vibration, all sorts of things like inputs. And then I've also done a lot of inner things. So let's talk about this dysbiosis again. Let's talk about leaky gut. Let's talk about leaky brain. Let's talk about what are those nutrients doing inside the body. And then that led me down into more of like the root cause medicine side of things. So we're talking about heavy metals. We're talking about environmental toxins. We're talking about PFAS. We're talking about things that attach themselves to the cell wall that don't allow the cells to actually communicate. And that's a lot of what was going on. When I was able to detox, when I was able to pull all of the toxins out of my system and heal my gut, heal my brain, heal the blood-brain barrier, a lot of the things that I was struggling with have dissipated. But one of the things is sleep. And so sleep is still a challenge for me. But one of the things that has really changed since I've been able to get rid of parasites, I know that sounds awful. We all have parasites, especially if you have a dog, if you have a cat, if you have a horse, if you have anything that is inside. If you've kissed your cat, you probably have parasites. If you've been, your kids playing in the sand, they have parasites. Everybody has parasites. If you're still living and breathing on this planet, you most likely have parasites. It just matters how intense those parasites have infiltrated your systems and what they're doing. And I will tell you that I have some really crazy pictures of things that came out of me after detoxing. And since then, my sleep has really altered in a positive way. So parasites like to be up at night and they keep you they stay active at night, and that's one of the things that keeps you awake. So getting rid of those has made a tremendous change positively for me to sleep. However, I also have my father's genetics, my grandfather's genetics.
She's what you would call a night owl.
A night owl. So our grandfather, who just recently passed, almost 100 years old, he was notorious for staying up till 4 or 5 a.m. and then he would sleep the first half of the day. And he was so productive. His mind was going all the time. He had so many experiments. He was a tinkerer. He loved, like, his brain was always thinking of something. He had experiments all over the house, all over the backyard, all over the basement, like just prolific thinker. So not like a dunce, but just slept differently. He slept at his own pattern. And I fall into that weird, not traditional pattern, unfortunately.
So she will have two alarms on race day.
Yes, 2 alarms or more.
Well, aren't we staying at the same house? So we'll just come bang on your door.
That'd probably be helpful.
Pull you out of bed. wave some coffee under there.
Yeah. Long explanation for that one. Sorry.
It's all good.
All right. Maybe what, 2, 3 more?
Yeah.
Okay. Who's most likely to make friends with a stranger in the bathroom line?
Yeah, I think Dr. Vicky and Colleen.
Yes.
We're the social butterflies.
Yes.
Okay. Who's most likely to plan the entire group vacation?
Oh,
Cheryl.
Kind of, yeah.
Yeah.
Cheryl.
Yeah, organized. Yeah.
I got 2 more. Sorry.
All right.
Who is most likely to win a costume contest with 0 prep time?
Christine.
Well, I think it's you too. I think it's Christine and Colleen, but those costumes are going to be very different.
Yes, they are.
I like a little prep. You need to give me like a couple days. I feel like Christine's like the champion of like, what do we got?
Throw it together.
Really? That's impressive.
Yes, I just won a contest at school.
Oh,
most mismatched. It was amazing. And then the last one. Who is most likely to buy matching pajama sets for the family or spouse?
Christine. Christine.
Yeah.
Oh, that's cute.
We do it every Christmas. It's a tradition now.
Yep. Yeah. So wait, Colleen, you don't do that with your kids either?
I like being festive and I like that kind of thing, but I want them to have their own style. Like, I don't do the matchy. Usually I'll be like, oh, like Elliot would love this because it has dinosaurs, or like we would have something crazy. Like I do love a crazy sweater. My husband and I have sweater rompers and full length jumpsuits for Christmas. But they're not matching, they're individualized.
I actually just bought matching jumpsuits for Christmas, like a few weeks ago. So we're doing it this year. Mm-hmm.
Nice.
We do pajamas, and it's not like you wear them with your family in your living room. Like, it's not like you have to go out anywhere.
Exactly.
Yeah.
Reminds me of those that caption, the meme, like the little girl's looking up at her big sister. I'm dressed just like my sister, and the older sister's looking down.
That was totally you.
Just like my sister.
We have a picture of you making that face and me. It's happened in real life. It was like the blue little stuff, and it was ruffles and everything, and you were not happy.
Oh,
Well, first off, it was ruffles.
It was ruffles. I mean, I don't wear ruffles now, but back then I was so excited.
You were
Big
very
sister.
happy. Yes. I look just like my sister.
oh, that's cute.
Oh God.
I think you're up, Colleen.
Yes. All right. So for everyone, what is the mood? So one word or phrase that sums up this month for you.
Mine is just keep swimming. Just keep going. It's going to turn out. I just got to keep going.
Yeah. Nice. All right,
Yeah,
Dr. Vicky.
Oh,
sorry,
go
Cheryl.
ahead. Dr. Vicky, go ahead.
Go ahead. I'm still thinking.
Okay.
Okay.
All right. Mine's very similar, and mine is just show up anyway. Sometimes you don't have to be perfect. You don't have to be the star, but if you just keep showing up, when I think about training, when I think about my business, when I think about family, being there for my wife and holidays, sometimes it's just a matter of just showing up and doing the best that you possibly can and being present at the moment.
All right, Dr. Vicky, your turn.
The days are long, but the years are fast. So I need to enjoy every minute with my kids. Because it's hard. It's hard. But I think the days are long, but the years are fast. So just keep that motto for the next month. So the end of the year, rather. Yep.
Yeah.
Keep it longer than that, because I was so grateful to get away from them to do this. I needed a break.
Yes. Me time is important. Yes.
It is.
Mm-hmm.
Yes. Yeah, definitely. All right. Well, I think I've concluded mine is going to be, I think just put my foot on the gas a little bit. So I've been very like reserved and like taking my time with my training and being a little bit more cautious at soccer. And I'm finally like hormonally feeling better and physically feeling better. And like, all right, let's turn up the heat. Let's put the foot on the gas and let's start to go. And so I think that's mine for this month.
Cool.
Excellent.
On everything. Do everything better. Like just start getting life back to normal, whatever that looks like.
Excellent.
Yeah.
All right. Well, that wraps up this month's episode of Sisters Before Blisters. And today was a really great reminder that we need to address our pelvic floor for health and longevity and athletic longevity. So a big thanks to Dr. Vicky for hanging out with us today.
Thank you. Thank you, sisters. You guys were awesome.
Yeah,
Thank you.
So next episode, we're going to dive into the bike, run, swim pointers and transitions. We have an expert lined up for that. And so we can't wait to dive into some of the meat of the actual race. So you guys can follow along with us on YouTube or anywhere where you get your podcasts. We are out there everywhere. And all you have to do is search for Sisters Before Blisters. And if you get a chance, drop a question in our YouTube comment section and we'll answer whatever comes up. We're interested to see what you guys want to hear. Until then, keep training smart, laugh when it hurts, and remember that progress isn't about being loud. It's sometimes just choosing to show up today, tomorrow, the next day. So we'll see you next time. That's it for this episode of Sisters Before Blisters. If you've enjoyed hanging out with us, hit subscribe so you don't miss the next one. And drop us a comment with what resonated with you today. Also, share this with someone who needs a push to try something new. There's nothing like trying something completely out of your comfort zone to remind you of what you're made of. Until next time, keep chafing the dream.